today we're going to review seating and dismissing. Well, actually, we're seating the patient. Our POS number for our task list is seat and dismiss a patient number 908. So I know you guys have some experience seating a patient, but a decent amount, but I wanted to review it because we get a little bit sloppy at this point in the school year because you're used to seating your friends and you just kind of let them hop in the chair and you know they're going to be okay. But I wanted to refresh your memories about the proper way to seat the patient to make them feel good about their experience from the beginning. Okay, so the first thing I want to do is you have a paper in front of you, a colored card in front of you. And I want you to look at this. So you want to imagine you're alone in a new place with people you don't know. How would you feel? So you're writing about how you think you'd feel in that situation. On one of those cards, use your marker and just put one or two words. Like, what would you be feeling in that type of situation? So you're filling in that blank. So just take a couple seconds and write it nice and big so everybody can see it. Okay, so Melissa, what did you write?
Awkward and nervous.
Okay, so come up and just put that here and just put it in a row under that. Awkward and nervous,
Okay,
that's
where?
a good one. Just right there, perfect. Okay. Brooke, I'm gonna come up with yours. Right here? Yep. Okay, so you wrote
Awkward and scared.
awkward and scared, okay. Holly?
I thought worried and nervous.
Okay, worried and nervous. Good. Okay, apprehensive and worried. Weird, okay, good. Kyle. Nervous, good, okay. Another nervous, okay, good. And Evelyn? Okay, awkward and nervous again. And Julia? Okay, another awkward. All right. Well, it seems like the common word today, awkward. Nervous and weird, good. Okay. All right, so you could imagine if that's the way you feel in a new situation, in a place, you're there by yourself, you don't know the people. Imagine how you're going to feel as a dental patient, or how your patients are going to feel, and you're the assistant. So as the assistant, what do you want to do? Right, Brooke says make them feel comfortable. 100% correct. So you want to make them feel comfortable, because if they feel comfortable, then what's going to happen in the patient's mind? Holly, you buzzing there?
They won't feel scared to come back.
Good. Absolutely. They'll want to come back. They won't be worried or scared coming back again. So, and as a dental assistant, that's a huge part of your job to make patients feel comfortable. Okay, so I'd like you to watch this little clip, and then we're going to talk about it.
Oh, the patient's here. Lindsay, the patient's here. Lindsay, the patient's here. Oh, where is she again? Where is Lindsay? She's never, what are you doing? We have a patient here. I don't understand what's going on. We don't eat in the lab. What's with the texting, the phone? Come on, we got a patient here. Your patient's
All right,
20
I'm
minutes.
gonna get her.
It's 20 minutes. We've had this patient sitting there for 20 minutes. We need a chart. I would think that would be the best thing to do. Do you know who it is that's sitting out there? You have a few charts there.
Yeah, I know.
Oh, you do? Okay.
Krista? Chris?
Kristen?
Oh, Kristen. Go, come on. Oh, okay, you can have a seat. Oh, wait a minute. Okay, there you go. Oh, so how's your new baby?
I don't have a baby.
When's your birthday?
10/14/1994.
Oh, the wrong chart. Okay, now we're good. Okay, she'll be in a minute.
Okay.
All right, Kristen, we're all done for today.
Okay.
It was good seeing you. Say hi to your family.
Will do.
And Lindsay will take you back up front, okay?
Okay.
All right, take care. Yeah, she's going to get, you got a little impression material over there, so she'll get that off for you, okay?
Okay.
All right, take care.
Yeah, I need to call you back. Bye. All right, you're set. Okay, so did you notice any problems in that? Everything. Okay, so what I'm doing is I'm going to hand out this paper, and we're going to fill that out, and we're going to talk about it on the board, too. So I'd like you to each take a problem, and let's fill it out together so that we don't have a lot of repeats, okay? And I'd like someone to come up to the board, and we're going to write in the problem column, what that is. And then we're going to talk about the effect on the patient, on the dental office, you know, how that problem affects everybody involved. And then we're going to talk about the solution. Okay? So take like a couple seconds and get some ideas in your head, and then you can each come up and write something up here. And then you guys at your tables, you know, jot them down as we go along. Anybody right off the top of your head have a good one? Okay, Brooke, come on up. So what one were you thinking of?
You had the wrong chart.
Okay, good. All right, so you can write that down, wrong chart. In other words, I wasn't very prepared, was I? No. Okay. Now, how did that affect the patient? How does that make them feel, like, most of
Well, it was like awkward because you asked her questions that found her that like if she had a baby and like she doesn't have a baby.
Right. I congratulated her on her baby, and she didn't have one because I had the wrong chart. Good. So it made her feel awkward. So you can come right back up here, okay? And then, what do you guys think about the solution there? How could that have been, yes, right under there. What type of a solution could we come up with to avoid that? Oh, check the chart. Good. So you want to just double check, make sure you have everything prepared. Good. Yeah. Okay, so what other problems did you see? Maybe even start to think of the beginning of the tape, you know? Go ahead.
She had a really awkward greeting.
Great. Yeah.
She didn't even know the girl's name.
Right.
She was just like, all right, whatever.
Good. I came out and I didn't know her name. I didn't address her right. And so you can come up and write that. And then, Erin, how do you think that made her feel? Have you ever heard of, like, when someone calls you by your proper name or addresses you the right way, it kind of makes you feel like you're important or a little respected, right? So maybe the patient could have been feeling like they don't even know me. Like, these people are just, they don't have any respect for me, So she could have felt a little disrespected. You can add that up there. What do you think our solution could be there?
Well, she was supposed to address a patient with their last name and no surnames.
Exactly, yeah. So we would have wanted to make sure as the assistant that I know how to address this person. If she's really young or something, then you might be able to get away. If it's a child, you're gonna call them their first name. If it's a person who is much younger and you figure maybe they're like your age, you could call them their first name. If they're a little older, you think they're out of high school, because you can tell in their chart by their birthday or whatever, then you can call them Miss, Mr., Mrs. So definitely you want to call them by their proper names. You can just write that up there. Proper name would be good. What other problems did you see in the video? Robin, you thinking of any? Okay. You start thinking, okay? I think you can come up with one. Right, yeah. I had a lollipop in the operatory. I also had food that was in the lab, right? Is that a no-no, food in the lab? Right. So, and it didn't make our dentist very happy, did it? Seeing me like that. So, how do you think that affects the office, me, the patient? How does that appear to the patient?
You don't want them to
Right. Exactly. It makes me feel perfect. So you can write unprofessional up there. So yeah, it makes me look very unprofessional and almost incapable, right? Like, what do I have here with this person? She's not really taking things seriously. So, and then our solution, 1, and then SSI. That's fine, don't worry about it. Okay, and so up there, you can just add the solution in. What do you think the solution would be? Right, not to eat. Yeah. That's fine. Or kind of behave, what was your word? a cell phone, I had an iPod too. So I couldn't even hear the dentist trying to find me in the office. So, really electronics, right? You can write either cell phone and iPod or electronics. So what effect did that have? Go ahead. Right, it upset the dentist. You can come up and write that, and also, any other ideas what that did? Think of like, she was at the computer, she's calling me, she's looking around for me, what was happening throughout that?
Just getting frustrated.
And as well, what else? What else has gone by? Right, time's gone by, There was a waste of time, so that it has an effect on the whole office. Everything's getting delayed and getting behind schedule. So the solution would be what? How about you, Evelyn? What would the solution be?
Never use electronics while you're working.
Good, okay, good. And you could say, everybody has their own style, but I'll show you how I do it when I demonstrate. But basically, you could just say your name and I'm your dental assistant or whatever, So you'll get your own style as you go along. Okay, Kyle, for number 5.
Request that the patient follow you in treatment.
Good. So it's just like when you're in a restaurant. Do you ever get like a host or hostess and they kind of have the menus and you're not sure if you should follow them yet because they didn't really say anything? So what works better, Holly?
Well, if you tell them to come,
Right.
and have them stand awkwardly there, I think that.
Exactly. So a little communication, like, okay, you can follow me or come with me or whatever. Okay. Number 6, we'll go to Erin.
Place patient's personal items such as jacket or handbag in a safe place away from the patient presentation.
Good. So patients want to see their stuff, so but we don't want it anywhere where it's going to get in the way or trip over it. So you just want to put that out where they can see it, but it's in a safe place. Okay, number 7 for Ellen.
Ask patients if they want to silence the demonstrate, then just use their legs underneath their chair.
Right. So, they're getting in the chair, you're helping them out, making sure everything's clear, out of the way, helping them out to get in the chair. Okay, number 8 for Julia.
Inform the patient before adjusting the headrest and chair if possible as well.
Right. So why do we offer them a pillow? Make them more comfortable, right? Some people might have issues in certain areas. Some people come in with some low back pain or their neck or something, and so we have pillows around to help patients out. Sometimes they need it, other times they don't, but it's a nice thing to offer it to them. And just make sure you don't forget to adjust that headrest because it'll make them feel much more comfortable in the position in the chair. Okay, number 9 for Melissa.
9, place the patient napkin over the patient's chest. Initiate conversation to help the patient relax.
Good. So you want to put the patient napkin on the right way and then start talking to them. So then their mind isn't on all those things that we talked about earlier, how they might be feeling in this situation. Okay, number 10, we'll go back to Brooke.
Review the patient chart. Ask them if there have been any changes with their health.
Good. So we know all about that we want to make sure that our health history is updated, even if they were there the day before, because anything could happen overnight that they had a change they need to be aware of. And number 11 for Holly.
Explain the plan, treatment, and answer any questions they have.
Good. So you just want to let them know. Patients come in and their lives are so busy, some of them lose track of like, what am I in here for today? Am I in here for a cleaning or am I in here for a filling or something like that? So you're the one who wants to let them know. And they might even have a different idea. Okay, so Holly, would you read number 12?
Review that all treatment room preparation. Are organized and set out.
Good, good, okay. Great, so just one more review, before you're set there, that you have everything ready to go for whatever treatment you're doing. And 13 for Casey.
Wash hands and put on PPE.
Right, because then you should be ready to go, or you can go get the dentist, however you're going to go about that. Okay, so this applies. Good intentions are not good enough. Ultimately, we're measured by our actions. So a lot of the actions that you saw in that video, kind of that patient's sort of judging, like, how's this experience going to go? And I bet they didn't feel too good about it. So good to be aware of our actions. Okay, so let's see how it's really done. I'm going to demonstrate how it should be done the right way. And as well, you each have a paper here that lists all the steps we just went over. And then I have a big one here that I can have out so you can reference it. So right now I'll show you what we're going to do, and then demonstrate, and then you'll get a chance to practice, okay? So let me just have 3 of you sit over here like you're the patient, and then I'm gonna come and get you just like a real patient, okay? So let's have Kyle, Robin, and Casey, okay? You guys sit right here. And then you others, like, after I get you, then follow me into the room. Okay, so, and there's a magazine if you want to look at it, okay? Because that's what patients do in the office. Okay, all right. Miss Bainbridge? Hi, how are you?
Good, how are you?
Good, good. My name's Lisa. I'm going to be helping you out today, okay? You can come right with me. And you can have a seat right here. Good, I'll adjust your headrest. Just rest your head back, see how that feels. Is that okay?
Yep.
Okay, all right. Would you like a pillow or anything for your neck or your back?
I'm good.
Okay, all right. And we'll put our napkin on. So welcome to our office. You're here for checkup today. Have you been having any other issues with your mouth? Okay, all right. Have you had any changes in your health history?
No.
Okay, good. All right. All right, so what we're going to do is the doctor will be in a couple minutes, and we're basically going to do an exam and possibly take some x-rays, okay? All right, be in a minute. Thanks. Okay, so that's the way, the steps that you want to go through. They're pretty quick and easy, all right? Okay, so next, what you guys can do is buddy up into your groups, each in the ops, and get a little practice in, okay? Now, what I want you to do, the third person, one's a patient, one is the assistant, and the third person's going to hold that sheet that I gave you that has all the steps, and you're going to make sure that the assistant is following those steps, okay?
Is your head rested okay? Would you like me to adjust it?
Can you get it? That's good.
Okay, is that good? Okay. Has anything changed in the last visit since you've been here? No? Do you know what you're here for? Checkup? Okay, good. I'm just going to put this napkin on your head. That's okay with you. You're going to
Good. That was good.
Are you comfortable? Would you like a pillow or anything for your head? No? Okay, so all we're doing today is doing a cleanup, checking nothing so serious, you know, the usual checkup every month. I'll go get the dentist, okay?
Okay. All right, we good? Okay. All right, now, since you got a little practice in, I just want to go over a couple things in ending. So, we got a little experience with seating our patient. We're aware of what makes patients feel uncomfortable. And now you should be aware of how to make a patient feel comfortable as the assistant and in that process of seating them. So on your second piece of paper, you're going to answer this. As a dental assistant, I can help a reluctant patient by. So just put a couple words in there, and then we're going to bring them up to the board. You're doing it right now. It could be all different things. Okay, Brooke?
I said I'm making conversation and smiling.
Great, perfect. Making conversation and smiling. That's good. Melissa?
By being friendly.
Good. Being friendly. Perfect. Julia? Making them comfortable. Really good. If you're sitting in that chair and your neck's uncomfortable or something, that's important. Good. Casey? Good, being friendly. Okay. Robin?
Smiling and talking.
Good. Okay. Erin?
Doing my job correct.
Oh, good. Okay. Doing your job correctly. So that would entail what?
Following the rules of being a dental assistant.
Okay. Just being a good dental assistant.
Pretty much everything.
Okay. All right. Can anybody elaborate on that? Or are we always checking that we're, like, what did we check in the room when before we even got the patient prepared, right? So that's huge, just being prepared. Okay, Kyle? Once again, friendly and nice too. Good. I love all this. The smiling is huge. To go out there and put a smile on your face. And Holly. I mean, we're in dental. They want to see your pretty teeth and they want to see smiles. So that's big.
And welcoming.
Good. Welcoming is perfect. Really, have you ever heard about first impressions? Like, they happen pretty quick. In the first few seconds, a person sort of makes that first impression. So it's really important for keeping those patients happy, and it also makes you happier in your job. Okay, so what would you say the main points are that you picked up today? Melissa?
Like how to be professional about seating the patient and do it correctly and make them want to come back to the office.
Good, good. Professionalism. And in professionalism, what else would we do? Like, what do we want to pay attention to? Think of the video. Think of our solutions that we wrote. Look at your paper and look at the solutions. So what do you have, Robin? What's one of them?
To know what you're doing.
Right, right. Being prepared, knowing what you're doing, feeling capable, right, with your job. How about you, Kyle? Behaving respectfully and treating others with respect. Good. That's good. Any others? Evelyn, do you see any others that we missed? Good. Having that professional appearance is key. It makes you feel more professional. It makes the the patient know that, okay, I'm in good hands here and I'm going to be well taken care of. Great. All right. Well, I hope you got a lot out of it. And then after this, we're going to talk about how to dismiss the patient because there's those steps involved with that. All right. Thank you.